the attendance link in the chat. So if you could fill out the attendance link, that would be great. But if there's any problems, we'll also be keeping track of the Zoom attendance. So before I introduce Ted, just a quick note about the format for today's seminar. We're going to be doing the same thing we did for the last two seminars, which means that you can just unmute yourself and ask questions when you have them. But maybe also, Ted, in case people are feeling a bit shy, you can occasionally just pause and check if there are any questions, because I know people often are afraid to interrupt on Zoom. We're going to go until 1:30 sharp, which is the beginning of the pro seminar. So if we have any extra time at the end, that will just be a Q&A period. And you can either, I'll moderate the Q&A, so you can either raise your hand on the participant list or just post that you have a question in the chat. Okay, so without further ado, let me introduce Edward Miguel. So Edward Miguel is a leading development economist and a professor at UC Berkeley. He's the director for the for the Center for Effective Global Action, which many of you may be affiliated with or interact with. And he's done really amazing work in many areas in development economics, including health, education. You're going to see a little bit of health today, I think, and political economy. And so much more work than I could reasonably describe in a short introduction. And so thank you for presenting to us, Ted. And today he'll be talking about COVID.
Thanks so much, Natalie. It's really great to speak to this group, and wonderful to share work with University of colleagues. So thanks again for the invitation. I'll be presenting some work, COVID, focusing on some evidence from Kenya, but also from a bunch of other countries, as you'll see. And this is joint work with a pretty big group of co-authors. I've listed some of them here. Michael Walker, Dennis Egger, Magdalena Larabur, Carol Nakesa, Andrew Aguirre, Johannes Haushofer, but with some of the work with many other co-authors. So, they are definitely huge contributors to this work. So let me just start with something that I think we're all familiar with at this point. I think we're all kind of probably thinking about COVID more than we might want. The COVID crisis really has swept the globe in the last 7 or 8 months. It's really affected society in so many ways. I guess we're all living that. The fact that I'm presenting in my garage is an indication of that. It's about the economic consequences of the crisis in different countries. But some of that evidence really has been limited by difficulties in data collection during this period, difficulties in collecting data during the pandemic, but also just the challenges in measuring living standards in poor countries in general. Some of what I'll present in this paper is going to try to fill in some of those gaps. I'm going to mainly focus on African cases, especially Kenya, but I'll also present some evidence from other countries. And it makes sense to be focusing on African settings like Kenya, just given the large share of population that's living on, very little income per day. Many of them were already facing risk of food insecurity even before the crisis. And the question we'll ask is whether that has, just gotten worse during the crisis. The upside, and I think we're all familiar with some of these arguments, is African populations, like the population we look at in Kenya, tends to be quite young, and so on average at lower risk of COVID morbidity and mortality. Actually, in the East African settings where we have data, levels of obesity are also low. So there's a bunch of risk factors that look a lot better in some African cases. And for some of our sample, they may not need to interact with the market or go into the office as much as others. A lot of their economic activity may be on their own farm in subsistence agriculture. So there are ways in which the world's poorest populations may actually be, significantly less vulnerable than, say, those of us in the United States. And I'll come back to some of this in the discussion later on, including a discussion of where Kenya is right now. So I'm going to really focus on three pieces of evidence in this this talk. So let me just go through them. I'll probably spend about 15 or 20 minutes on each one, and then we'll have some time for sort of discussion of policy implication. I'm going to start with a discussion of some phone survey data that we've been collecting in Kenya. We were in the field following up. We were just about to start a medium-run follow-up survey for a study, an RCT study on cash transfers. And some of you may have seen this paper. This is a paper we released last year, Egger et al., which looked at the kind of 18-month follow-up of cash transfers that were distributed between 2014 and 2016 in Siaya County, Kenya. We were in the field earlier this year collecting longer-term follow-ups when we were just about to launch when the COVID crisis broke, and we basically transitioned our field team to collect phone surveys on the sample. And so we started that in early April. So, because we had the team kind of assembled, the crisis starts in March. Kenya starts locking down in late March. And by early April, we were collecting data, including some data with a recall period of a couple weeks. So we're basically capturing like the descent into the crisis in Kenya. So I'm going to focus on some of this data today. We collected pretty detailed data on economic outcomes, social outcomes, public health knowledge. I'm mainly going to focus on the economic outcomes today, but if folks have questions about our other findings, I'm delighted to discuss them, without necessarily having slides on all the data, but we've generated that data for certain audiences. So we started again first week of April. We ran these for 20 weeks and had pretty good tracking rates. So the overall response rate in our sample was 79%. And the reason we were able to get it that high is over 90% of households had cell phones. We had actually just completed a household census in this whole area. So we had just updated all the cell phone numbers, contact information. And then among those with cell phones, we were able to contact almost 90% of them by phone. And that gave us the overall rate of 79%. So I'm mainly going to focus on the data for April, May, and June, partially because in some of the other data I'm going to present from other countries, there's this common time frame of April, May, and June. So just for commonality, I'm going to present that. But at a few points in time, I'll mention sort of what the trends look like in July and August as well. In terms of the Kenyan case and what we can learn from it, Kenya is actually fairly typical in terms of its COVID timeline. In mid to late March, the crisis started. There started being lockdowns. There were pretty harsh mobility restrictions where people weren't supposed to be coming in and out of Nairobi, say, except for truck drivers or people shipping goods. And international airports were shut. And then several months later, things started loosening up. So even in June, there started being some loosening, and then that accelerated in July and August. In terms of the more recent timeline, just a few weeks ago, some schools started reopening, certain grades started meeting. And really, throughout this time period, overall rates of COVID infections and deaths have remained quite low. So as of yesterday, when I looked in Kenya, since the beginning of the crisis, there were, quote, only, of course, it's a lot in absolute terms, but, only 900 COVID deaths recorded in Kenya, a country of 50 million people. So, the United States gets more than that every day. Just so, so basically there's like, orders of magnitude fewer deaths in Kenya than in, per capita than in Europe or the United States. So, that's where it's at. And that's part of the reason why there's been so much of an opening recently in the last couple months. Again, the period I'm going to study is really going to be that initial period. And we're going to ask this question about what happened to economic activity in our study area. How much were affected, and then later on in the talk, I'll have something to say about who was affected in this initial period. And this study area is pretty big. It has a population of about 300,000 people, and we worked in almost all villages in this area. So we have like a really good coverage in a decent size population, Siaya County. Okay, so I think as I alluded to above, measuring living standards is challenging in low-income settings. I think all the development economists in the room know this. We spend so much of our time and effort just trying to measure basic things like income. And in rich countries, you get somebody's like pay stub and you're done. For us, it's a lot more challenging. There's informal employment, there's home production, there's subsistence agriculture. And for that reason, a lot of the reports that have been coming out in the last several months about economic activity in poor countries may not be super accurate, just because they haven't been doing tons of in-person surveys at all. And they're relying, if they're relying on things like formal sector taxes, pay, other things, they're just missing a lot of economic activity. And that's why really detailed surveys like the World Bank LSMS style surveys were designed. And so we're gonna try to implement something similar to that as best we can, given that we have to administer phone surveys in the crisis. We can't go in person and do a super lengthy survey. We were really limited to have surveys that were no more than around 40 or 45 minutes by phone. More than that, it's just really hard to sustain a phone survey, but we did kind of push the envelope right up until that limit to get as much data as we could realistically during this time point. In some ways, data collection during the crisis was a little easier because people were like very often sitting at home, and that made it a little bit easier for them to stick with a 40 or 45 minute phone survey.
Before you get into the,
go ahead, yeah, please.
This is Don Tryman, sociology, UCLA. Before you get into
go for it.
Hello. Before you get into the economic consequences, perhaps you could say a little more about why the per capita death rate was so low. Maybe you said something about this. I came in about 5 minutes late. So if you've said it already, tell me to go look at your papers and be done with it.
Oh, no, I mean, it's, our paper isn't focusing on that per se, but the kind of speculation and, those who've been writing on this have been commenting on a few factors. One is the importance of the age structure. So, most sub-Saharan African countries have a median age between 15 to 20. And the vast majority of the population is non-elderly. And we do know that with COVID-19, morbidity and mortality correlates so strongly with age. So that's just like a fundamental difference. That's a protective factor, you could say. The other one is rates of obesity, while rising in many African countries relative to say 10 or 15 years ago, do remain far lower than they are in the United States or Britain. So the combination of a very young population and a largely non-obese population, death risk from COVID. There could be other factors. People have commented on the fact that maybe there's greater experience dealing with disease epidemics, infectious disease epidemics because of Ebola and others. So maybe there was greater preparation on that dimension as well.
One
so Donald, I hope
please.
that kind of
yeah.
Okay, I hope that
Go ahead. Does that
I was
mean?
just going to say, I hope that helped a little bit.
Yeah, it did. But does that mean the infection? I'm sorry, I stopped my video because I have an unstable connection, but my audio is still working. Does that mean that the infection rate was similar to other countries, but the death rate was lower, or does it mean the infection rate was lower?
There have been some surveillance surveys of COVID that have found non-trivial antibodies in the population. So there has been quite a bit of spread of the virus. Testing has lagged in Kenya and many other African countries. So it's a little bit hard to know what the case rate really is. But there are a lot of cases, and the number of cases recorded has been climbing in recent months, but the death rate really hasn't. So I think the best guess is the virus, is a pretty large fraction of the population, maybe similar to Europe or the US, has gotten infected. Deaths are much lower. That's my guess data that's been coming out of Kenya.
Thank you.
We have not been testing, so I can't tell you sort of test rates because we haven't been doing those kinds of tests ourselves in our sample. I do know in our study area, there is some work just getting started that is trying to do some more comprehensive testing to try to get at COVID prevalence. So,
but
thanks for the question.
Ted, this is Randall Kuhn from School of Public Health. Just to clarify, so there's no sense that there's any kind of either anecdotal or observed from indirect reports of any underreported burden of morbidity or mortality, right? That as far as you know, it may have, I mean, because this is a rural area that certainly a lot of those antibody studies are in urban areas. So I guess, I don't know whether you're able to say whether there's some, right. Is there possibly some undetected burden or nothing at all or unknown and kind of to be determined?
Certainly in the Kenyan newspapers, there's been discussion of that. And my guess is there is some undetected burden. The newspapers have also been reporting on the hospitals and hospital situation. And there hasn't been the kind of surge in ICUs or in hospitals that you might see if there was like a lot of undetected morbidity and deaths. Although just yesterday, I saw an article in the Daily Nation suggesting that maybe for the first time in Nairobi, there are some ICUs seeing more traffic from COVID cases. So I think it's plausible that there is some undetected burden, but the levels of deaths that are recorded are just so far below, say, in per capita levels, what we see in Western Europe or in Europe and the United States, that I think there's a consensus that there really is a lot less morbidity and mortality, but the measures may not be fully accurate. I mean, that's my best guess trying to read the newspapers and a couple of scientific articles that have come out. There's obviously a lot less scientific work, unfortunately, coming out, from Kenya than in the US or something. But from what I've seen, that would be my best guess. I hope that's helpful.
Yeah. And your sample, the original study includes migrants. Were you following the migrants here?
Work did track migrants. This sample, population snapshot in 2020 of population in this area and not migrants. So it's going to be, we had looked at this population 5 years ago and tracked them as they moved. That's true. But what we did in early 2020 is we recensused this county, or almost all villages in the county. And that's the population I'm going to talk about. So this is going to be a rural sample, the Kenyan sample I'm going to talk about. And then later on in the talk, there's a couple of other Kenyan samples, including a national sample with urban representation that I'll also talk about. But I'm going to start with this rural sample. All right, thanks for those clarifying questions. And everybody, again, feel free to jump in with questions or go into the chat. It's a little hard for me to see the chat when I'm on shared screen, but maybe Natalie or somebody else, if there is a chat, you guys can interrupt me and I can deal with it.
I'll take a look at the chat, and also in the Q&A at the end, people can also post questions in the chat and we'll go through them.
Great. Awesome. Yeah. Awesome. Thank you. Okay, so we collected detailed measures by phone. As I said, we kind of went up to this 40 or 45-minute long phone survey. We tried to collect household consumption. We had a couple dozen household consumption expenditure categories. So that's not as much as the full LSMS surveys, but still pretty decent. We collected individual productivity measures, both formal and informal employment, wage earnings, self-employed profit for firms with businesses, revenue and profits, both in the agricultural and non-agricultural sectors. So we tried to get as comprehensive a measure as we could, given that we could only ask really like kind of high-level questions about total earnings, total revenue. In a more detailed survey, again, as the development economists will know, we'll really dig into the subcategories more, but we're still pretty confident in these measures. And we did this for a representative snapshot of households and firms in Siaya. So that's a nice feature. Since we had just recensused the area, we're able to get a representative snapshot here. Okay, so that's going to be the frame. And what do we find? I want to basically just show you the data for the first 15, 16 weeks of data. And this is running from the surveys that started in early April with a 2-week recall all the way up to the surveys that we get through the end of June. So like really the first 3 months of the crisis during the lockdown. We have Let me start with some enterprise data. We have enterprise total revenues in the last 2 weeks, total profits in the last 2 weeks. And then, when we started collecting this data, we asked for recall back to February, the pre-period. So this is going to be based on some of those recall questions. There's always some concern with recall, but again, we did try to prompt the respondent to be accurate and think of it, I think it was the last 2 weeks in February, just try to be specific. And so you can see the data here in this top panel. The yellow line is profits, the gray is revenue. And again, this is, across surveys of thousands of firms in this area. So we have, quite a large sample. There were, I think it was 8,000 households. And I'm forgetting the exact number sample of households and firms. You can see really large drops in revenue and profits from that sort of February benchmark into May, when we started collecting the detailed firm data. It remains low throughout May and June. There's this really big drop. Again, for reasons of comparability with what I'll show you next, I'm only going to focus on the first few months of the crisis. We continued collecting data into July and August, and I will say there was a partial recovery then as the economy opened up and as the restrictions were removed. Doesn't go all the way back to the baseline, but there was a partial recovery. That said, there was a pretty sustained drop in revenues and profits, with this drop of like 40 to 50%. So like really substantial decline in enterprise revenues and profits. This was a major recession in this area. We can then go on to some of the household outcomes. So total earnings, as well as their consumption. So in this figure, again, over the same time frame, we have earnings in orange and we have consumption in blue. And again, here, we don't need to rely on recall because we started collecting data first week of April with a 2-week recall, which just captured like the very start of the lockdown. So, maybe we're even understating some of the drop if already by March 23rd, there was already something of a decline. But so this is maybe a little conservative, but we're finding drops in earnings and consumption more like of 23 to 25%. And in fact, it's kind of interesting. In the first month or so of the crisis, you can actually see that, earnings fell more than consumption. So, household earnings were plummeting, kind of like when firm revenues and profits are falling due to the recession. Consumption was still a little bit higher as households were trying to sustain consumption, during the recession. Eventually, though, consumption and earnings kind of track each other. And there's this drop, pretty similar drop in both over time. Again, I'm not showing you the data out to August, but there was something of a recovery in both of these into July and August. Finally, we have a measure of food security, and we asked this a couple different ways. The kind of simplest measure, and the one I'm presenting here, is how many days in the last week did adults in the household miss meals, and how many days in the last week did children miss meals. And on average, for children, it was something in the pre-period, the average, we had collected surveys in previous year. So in a kind of typical previous year, about 0.6 of a day per week, children would have missed a meal, and about 1 day a week, adults would have missed a meal. So it was non-trivial amounts of food insecurity, as you might expect. But food insecurity really increases during the crisis. So as we see consumption falling, in the middle panel, we see food insecurity rising and staying at this kind of higher level, both for adults and children for several months. Now, towards the end of the period, it starts to decline. And actually, it continued to decline a little bit into July and August as well. So food insecurity, rises a lot during this period, although again, towards the end starts to improve. This, of course, in a poor rural Kenyan setting where there's already a lot of food insecurity, an increase of 20 to 50% in food insecurity is very meaningful and troubling. Okay, let me pause and see if there's any questions on. This is our kind of just descriptive snapshot of trends in the data. I'd love to hear people's reactions if there's any questions.
Sorry.
This is
again.
Okay, go ahead.
Just for context, could you say what was the baseline level of missing meals for adults and kids?
Yeah, so for kids, it was 0.6 of a day per week. And for adults, it was 1.0 days per week.
That was the baseline. Okay.
That was the average. Yeah, and that was in a survey collected, like a pretty comprehensive survey collected 2 years earlier. But then we also had one 4 years earlier, and they were at similar levels. So the kind of, it seemed like the steady state food insecurity was at around that level. And then here you can kind of see the increase.
This is Don Tryman again. This is a little confusing to me because of the different baselines. Can you tell us what the absolute level of well, let me rephrase this. I want to be able to compare adults and children in terms of the absolute level of food insecurity rather than relative to a baseline. Can you give that to us?
Yeah, so if I were to convert those there, I would multiply the adult one. The average is 1.0. So this would be an increase of about 0.2 additional days per week of food insecurity for adults. That would be the kind of absolute increase from about 1 day a week to 1.2 days a week. And for children, the base level was 0.6 of a day per week. And so this 55% would be like another 0.3 something. So maybe it would go from like 0.6 to 0.9 or to 1. So actually for kids, it's a pretty large increase. So about 0.6 of a day a week to 0.9 day per week on average, if that helps.
Yeah, that helps a lot, because that tells me that in absolute terms that kids are not as food insecure as adults are.
That's right. That's right.
Yeah.
In normal times, you see more reported food insecurity where adults are saying, I'm missing a meal, maybe so my kids don't have to. But during this crisis period, like they're both rising. Yeah, that's right.
Okay, but in absolute terms, the adults are missing more than the children are, which is what I wanted to know.
Exactly.
Yeah, otherwise it would seem quite strange relative to other countries around the world. But
yeah,
okay,
that's right. The percentage increase. Yeah, the percentage increase is larger for kids, but even during the crisis, adults are still missing more meals than kids.
Thank you.
Thanks for that. Thanks for that question.
Can I jump in?
Oh, please. Yeah.
So maybe you're coming to that, so let me know if you want to postpone the answer. But do you see any heterogeneity depending, for instance, on the rate of informality on the labor market, depending on the areas where they are living?
Yeah, I'll come back to that a little bit, both for the Kenyan data and for some other samples. For some related measures, I'm going to show you data broken down in a particular way, which is those above and below median socioeconomic status, say, for instance, as proxied by total consumption levels pre-crisis. And we'll see differences broken down in that way. So I don't have it broken down by informality. We have that data, but what I will show you is broken down by somewhat richer and somewhat poorer households. And that's maybe in 6 or 7 slides. So thanks for that question. And I'll maybe defer the answer a few slides and then we'll discuss it. Thank you for that.
Are you going to talk about gender as well?
Yeah, so we've looked at that in this sample and we don't find meaningful differences between female-headed households and non-female headed households. So I'm not presenting those differences here. It's something that we were interested in. But the patterns here in terms of household consumption, adults missing meals, we don't see differences. Where I will show you an interesting set of patterns related to gender differences is again, in 7 or 8 slides, I'm going to show you some domestic violence outcomes. And that's very gendered and again, some troubling gendered patterns there, but maybe I'll hold off a few slides to get to that result. Okay, let me mention one more thing. This is a kind of maybe of interest to those who have a policy interest. You can see at the bottom of this slide, we have this link, kenyacovidtracker.org. We've been continuously updating the data from these surveys, and I think there's now 5 other samples of surveys that have been collected during the COVID crisis in Kenya, really in real time. Every week we've been posting the data, sharing it. We've had discussions with foreign aid donors, government agencies, the Gates Foundation, et cetera, to share this data. So if you're interested in it, please check out Kenya COVID Tracker, grab the data, use the data however you want. But we've been trying to kind of get this data out in real time during the crisis. I think first posted the tracker in May It took us a few weeks to kind of just get it, the website going, but we've been updating it continuously. So we've been trying to create this resource, and we do know that some government officials and others have been interested in that data. Okay, so this is a summary. Oops, sorry. This is a summary of the kind of some broad patterns in the data piece. I'm going to show you a analysis based on this same sample. And then the third piece of analysis is going to look at a cross-country sample that I'm involved in. But let me focus on the second piece. As I mentioned, we're working in this first bit of analysis in a sample that was part of it. Not in development, they may. Can you guys hear me okay, or is my?
Ted, I think you cut out just for like maybe 50 seconds, 30 seconds. So maybe just going back to describing what the sample was from. And I think that will catch
sorry
us
about
up.
that. Okay.
Yeah,
Great.
I think we all are just dealing with the Zoom connectivity stuff. So thanks.
Okay. Sorry about that. Okay, so let me just start with this piece. I think I had finished. You guys heard about the Kenya COVID tracker stuff. Is that right, Natalie?
Yep.
Okay,
we're
great. So let me just start here.
Off. Yeah.
Okay, thanks. So this sample I was talking about was part of a project that provided conditional cash transfers in an RCT in Siaya County, Kenya, and again, started in 2014 to 2016 is when the cash went out. What we were also interested in is whether receiving that cash, 4 or 5 years ago, yielded any benefits during the crisis. We did show in the short run, sort of or the medium run, over 18 months, that those who received the cash benefited in many ways. They had higher consumption, they accumulated more assets, and people have shown this with other cash transfer programs. The key design feature of that earlier study, the Egger et al. 2019, is we also measured effects on non-recipients in these communities and showed spillovers, mainly positive spillovers in multiple dimensions. So, if I got a cash transfer, I tended to spend it in a local business, so their revenue went up, so their wage bill went up, et cetera. So that was the earlier study. These were very large cash transfers, and that's what the NGO Give Directly gives out. They give these cash transfers that are like 75% of average annual local income, so like a huge transfer. And again, what we're interested in is during the crisis, did the folks in the treatment group do better because they had benefited from the earlier cash transfer, accumulated assets for whatever reason? Okay, so that's the question here, and I'm going to show you the simple comparison between recipients and non-recipients, treatment control, just to get a sense of what happened. And I'm going to show you the same outcomes pretty much I showed you before. So let's start with earnings and consumption. And let's start with the top left, earnings. The solid orange line is the average for the treatment group over the same period, late March to late June. The dashed line is the control group. And then the bottom panel is consumption. Again, the solid line is treatment, the dashed line is control. And you can see if you look at earnings, again, this kind of decline over time, as I kind of showed you before. Now, for a period there in late April into May, it does appear that the treatment group is doing a little bit better than the control group. Their earnings may be a little bit higher. That said, this difference is kind of minor, maybe 3%, and we certainly can't reject a zero effect given the statistical power we have. The standard error is 7%. So, it's suggestive, but, not very strong. When we look at consumption, we see a kind of similar pattern. Again, for parts of April and maybe early May, it looks like the treatment group may have a little bit higher consumption. Everybody's consumption's falling, but the treatment group may be partially insulated. Here, eventually, though, they kind of look the same. Once again, we don't want to overinterpret it because consumption, the difference is relatively small. The standard error is relatively large. So we're not going to overinterpret it, just to say that maybe there's some suggestion of a small improvement in the treatment group, but not much really going on. We see a little more action on this missing meals measure we were just talking about. Here, breaking it down for adults and children. And again, this is in the percentage terms we had it in before. And what you can see is, again, especially early in the crisis, you see this kind of big increase in missing meals among adults. Same thing for children. For the adults, though, it's an interesting pattern. It does look like the increase in missed meals is greater for the control group initially. And again, the treatment group may have been able to shield themselves somewhat against this rise in missing meals, perhaps because they had accumulated more assets. We had documented that part of the cash transfer went into wealth, which one could dissave during a crisis. So that could be part of the story. And in fact, in our survey, we ask about dissaving, and you see exactly this pattern, a big increase in dissaving in that period in April. When the crisis hits immediately, households are selling assets in order to eat, basically. So that could be part of the story. The story for children is kind of similar. You see, less of an increase in the treatment group, although again, by May or mid-May, they start trending together. And those differences are not quite significant. So again, the story here is, I think, partial. It's not like there's a clear bit of evidence that the earlier cash transfer helped, but it may have helped a little bit. And that's kind of maybe what taking all this together, these various measures, those who had been assisted 4 or 5 years earlier are still maybe doing a little better during the crisis because they've accumulated a little bit more wealth. Okay, let me pause there and see if there's questions on these patterns.
So I have a question. Thinking about the effects of the cash transfers, did that change kind of what industry or type of jobs people had at all in ways that may have, affected how they were affected by the pandemic, either positively or negatively? They were more likely to be entrepreneurs. Maybe it's actually riskier now, or it's actually worse to exit agriculture because social distancing is a bigger problem if you're not working in agriculture.
Yeah, we looked at that, and both over the 18-month period and in this 5 years after the cash transfer, we don't see significant changes in occupation. So we thought when we gave out cash, we might have seen this big surge in entrepreneurship and small business formation. We don't actually see that among the cash recipients. We do see that earnings go up. If you already have a business, we see that wage earnings go up. People are sort of doing better in the area, but we don't see these big shifts in sector. And that was, maybe one of the surprises of the initial study. But even in this 5-year COVID follow-up, we don't see significant differences by occupation. So that's part of the reason I didn't we're not thinking of that as a major channel. We think probably the accumulated wealth is a more obvious explanation in this population.
Thanks.
Ted, this is Randall again.
Oh yeah.
I know you're moving pretty fast, so I don't want to make your life too complicated, but even at 79%, even at 79% follow-up, you could have some sensitivity to differential attrition. I don't know if you've been able to look at that yet. Oh,
yeah, I should have mentioned that early on, that the tracking rates in the cash transfer, treatment, and control are almost identical here. It still could be that even if the overall rate is 79 versus 80 or 78 versus 80, that there's some differential composition. One could worry about that, but we're not super worried just because the overall rates are pretty high and they're quite balanced between treatment and control. So yeah, I should have mentioned that balance before. Yeah, thanks for that question.
I think Victor also has a question. Victor, do you want just to mute yourself and ask it, or if you before I can ask it? Victor,
later, because it's kind of more generic question. Most immediately, if I still have this opportunity, I just want to limit. Of course, it's a short period of time, but I just want to make sure there's no agricultural cycle is not does not affect this any way in terms of harvest time versus.
Yeah, fantastic question. I'll have a slide on that later, but let me anticipate it here because it's a big issue. This period, of course, in the Kenyan setting, for people who are familiar, there's 2 crop cycles, and we're sort of during this period coming into really towards the end, into July and August, into a sort of harvest period. Mm-hmm. So this period from March to June is a period where in other surveys, people, and in our own data, earlier data, you do document some decline in consumption and revenues for firms on average, but the magnitude of those declines is something on the order of 5%. So it is true that we're moving into a period of sort of like, a negative kind of seasonality trend, but the average effect should be on the order of 5%, not 50%. And so, maybe that's second order relative to these magnitudes, but it could still be a small component of these declines. So thanks for that question. I'm going to show a slide later when I go to the multi-country sample, because in some of the samples for other countries, we can look more directly at seasonality, but it's something that's been on our mind a lot. There was another issue in a subset of our county, like one side of the county, there was some flooding early on in this period. But even if we look at the non-flooded areas, we get the same pattern. So we kind of managed to convince ourselves that it wasn't the harvest or the flooding, but it was really the crisis. Any other questions on these patterns? Okay, let me move forward and talk about this third piece of the puzzle. I've spent about 20 minutes on each of the first two. This may take 20 or 30 minutes, and then we can have a broader discussion. I've been really lucky to be working with a large team of collaborators. Starting in around June, we kind of connected with some colleagues who are all doing these rapid surveys during COVID and decided, let's pool our data. So we managed to pool 16 different surveys. And what I showed you from CI County is just one of those 16 from 9 different low and middle income countries to try to understand broader trends. It's not fully representative. We're not going to claim this is like the global representative sample, but we do have Asian samples, African samples from different parts of Africa. We have one Latin American case. So we're feeling like this is giving a broader perspective. You can see the list of countries here. My co-authors and I had assembled these 3 Kenyan samples. Mushfiq Mubarak at Yale and co-authors assembled the 5 Bangladesh samples. If you guys know Mushfiq's work, he does a lot of work in Bangladesh. And then Susan Athey, Dean Carlin, and others had worked on some of the other samples. So I'm going to show you like a snapshot of, some comparable data across these countries to give you a sense of what's going on. The measures used are different in the surveys, but there was enough of a common core of data that I can present some common variables here in terms of income, employment, food security, again, during that kind of like late March to late June period. And just to kind of preempt the main finding a little bit, we're going to find drops in income actually in all 16 settings during this time period, with a pretty wide range in the drops of income, which is interesting. But of course, as I'll tell you, the populations are quite different. The median share of people who claimed during this period they experienced a decline in income was 67% across these samples. So like very high share, and also show you some food security measures that show, again, very high shares of population were experiencing greater food security across these samples during the period. Okay, so this is a summary of the data. And let me start with some of the Bangladesh data. And I know this table is kind of mind-numbing with all the numbers. I was trying to figure out ways to show a subset, but again, this is kind of a descriptive paper. So, we're all, data people. So we can just dive in. We can start with we call BGD1 there, this pretty typical rural sample in a part of northern Bangladesh. And again, the columns where we have common measures in most surveys are, did you experience a drop in income during this period, a decline in employment? That's column 2. Reduced access to markets, column 3. In some cases, we have difficulties accessing healthcare, column 4. Column 5 is this missed or reduced meal. So it's the food security measure I mentioned before. Column 6 is, did you receive government or NGO support? And then the sample is on the right. Okay, so each of these different populations have different sample sizes. This is a pretty decent sample, the rural Bangladesh sample. The other thing we do is we have pre-data on socioeconomic status. And here they distinguish it based on wealth. In some of the Kenyan data, I'll show you, we distinguish it based on pre-crisis consumption. But there were just slightly different measures in the surveys. What you can see in this typical Bangladesh sample is 81% of the sample experience a decline in income. That's a huge share. 25% experience a decline in employment. So that's a lot. This, of course, does not tell us about the depth of the decline. This is just, did you experience a decline? It could be $1 decline. What I showed you from Kenya shows you the depth of the decline. And I'll show you a figure in a few slides that shows depth of decline from another sample as well. So this is more what economists would call the extensive margin rather than the intensive margin. But still, 81% of people experiencing a decline. What's so striking about BGD1 is you can see both for low and high socioeconomic status people, there's this huge decline. Maybe a little higher for low socioeconomic status, but pretty much it's like an across the board decline in income in this population. So that's quite a striking finding. Missed or reduced meals, about 10% of population had missed or reduced meals increase. So, that's actually lower than a bunch of the other populations, I'll tell you, but non-trivial. And then if you look at column 6, almost no one in this kind of rural area, northern Bangladesh, was receiving any support during this period, any government or NGO support, only 2%. Okay, so that's one population. And now let's just focus on BGD2. So Mushfiq's team has been working with Rohingya refugees from Myanmar in Bangladesh. And here they have a pretty representative sample of the camps. They actually census the camps, and I think it's a representative sample as of a census a year or two ago. Again, for that population, there's quite substantial declines in income and employment, 44%, regardless of the socioeconomic status of the refugees. I mean, actually, the refugees on average are very poor across the board. Reduced access to markets, 31%. So they're finding it more difficult to access markets than a kind of more typical Bangladeshi population. And they do experience a larger increase in missed meals, 27% in column 5. But column 6 is very different. You can actually see a pretty substantial share of the refugees did say they received some additional NGO or government support during the crisis, which may not be totally surprising. They're living in camps. There's a humanitarian aid network tapped into the camps. And so some aid managed to reach the refugees. Okay, so BGD1 and BGD2 are pretty interesting. What I want to do now, I'm not going to go through all these, or else, we're all going to, our minds are going to go numb. Let me just jump down to the other end of the income range in our study. And I should say this data is a study that's under revision at a scientific journal right now. So hopefully it'll come out soon. But this is a paper, and we can share that with folks who are interested once we get it through the scientific journal process. Let me jump down to Colombia. So just jump down a few panels to Colombia. Colombia is a middle income country, not a low income country. Pretty decent per capita income, pretty high capacity state, actually. If you jump down to Colombia, you'll see in column 1 very large increases in drops in income, and same thing for employment. This was a huge recession in Colombia in terms of proportion of population affected. Here, there's a little bit of a socioeconomic gradient for those.
We just lost your video. A little bit of socioeconomic gradient, and then at least I lost it.
Yeah.
Now or?
Oh yeah, we can hear you now. Perfect. So I think your video is not moving, but we can hear you talking.
Okay. Maybe I should just turn off my video. You guys can see the screen. Maybe I'll just turn off my video. Let me just do that in case there's some sort of bandwidth issue. Okay. Is that okay? So I've turned off the video, but hopefully you guys can still see the screen. And during the Q&A, maybe I'll turn the video back on. Okay. So Colombia. In Colombia, you can see that among those with low SES, there's an even bigger decline in income, 95%. Among those with higher than median SES, it's about 86%. So, and I can kind of highlight those numbers there. So people can kind of see that now. All right. So, big drops in employment. Here in the Colombia case, there was actually measures of healthcare access delayed. Very large shares of people say they had some problem accessing healthcare during this period. So 40%, and very large shares of people saying they missed meals. Again, even though this is a middle income country, and among those below median SES, it's 75%. So again, even in a country like Colombia, which is pretty high capacity, and if you look at column 6, you'll actually see a pretty substantial share of population was receiving government support. So the Colombian government actually sent out cash transfers to try to assist people during the crisis pretty quickly. And some of that program is actually being studied by a UCLA colleague of your guys, Juliana Londoño Vélez, you can see despite that assistance and despite Colombia being a middle income country, there really is some severe economic distress during this period. Okay, so Bangladesh and Colombia, very different per capita incomes, but both with pretty severe outcomes. Let me just go on to the next, the next slide here. The top panel in, can you guys, is there a question? Victor, do you have a question?
Yeah, I have a question. Victor, we aren't hearing you, Victor.
Yes, I just want to have, if you don't mind, I was looking at the rest of the table and I just want to see, like Ghana seemed to be very similar to Colombia, in a sense, on some indicators closer.
Exactly.
Perhaps.
Ghana is much poorer than Colombia.
Yeah.
Per capita income is probably like 3 or 4 times higher in Colombia, but you see patterns that are not dissimilar, actually, in terms of the kind of effect of the crisis during this period.
Can you any thoughts about like Ghana versus Burkina Faso, for instance, difference? If is this?
Yeah, I mean, on some level, you might look at that and say, "Wow, that's puzzling," because Burkina Faso is much poorer than Ghana, actually. Mm-hmm. But again, this gets back to a little bit of what I was alluding to above, that a larger share of the population in Burkina Faso are subsistence farmers. Right. They're poor. Like, they're not doing worse than Ghana, even though they're poor. I mean, the numbers are pretty similar, but you don't see, for instance, in terms of missed or reduced meals, if you're a bit richer, more urban, et cetera, like Ghana, actually the rate of missed or reduced meals is worse in Ghana than Burkina, which is a more agrarian society. So, that's one explanation. We toyed with the idea of maybe trying to do some analysis or some regressions correlating these drops with things like, country income levels. But since we only have 9 countries, we hesitated to do that. But I do think that some of these pairwise comparisons are provocative, even if not super statistically robust. So was there another question too? Someone else had jumped in.
Yeah, this is Don again. And I don't want to get in the weeds too much, but I noticed the very small fraction in Colombia of low SES people. And you had mentioned median, above the median, below the median income, but less than 20% are low SES. Is it measured differently, or and should we just not worry about it for these purposes?
Yeah, that's a fantastic question. What you're going to see actually in all 3, Burkina Faso, Colombia, and Ghana, is these were phone surveys that were done under what's called random digit dialing, where literally random numbers are called until people pick up, and then information on the sample is collected. And it turns out in Colombia, the proportion of people who actually pick up the phone and answer the phone, once you link their characteristics to national samples in terms of, say, income, et cetera, this is very skewed towards a richer sample. And even in Burkina and Ghana, there's more people who are above median than below median in all of those, although it's not quite as extreme. But this sort of random digit dialing, and we have an appendix where we try to address these issues and discuss them. I have a slide later on where I'll briefly discuss them, but these are not necessarily fully representative samples, these random digit dialing samples. So that's exactly the reason why the low SES sample size is lower. We're having trouble reaching poor people. That said, we still wanted to break it down this way to say, okay, among the poor people they were able to reach, here's what the data look like.
Does everybody have a phone?
In a place like Colombia, the rates are quite high, but still not universal. And same thing in Ghana and Burkina. In all these countries, the majority of population has phones, but it's not universal. So that's part of the reason why you may get fewer low SES sort of across the board.
Thank you.
Yeah. Thanks for that question. And I should have gone into that. Again, I have a slide later where I get into some of it, but you're right, to interpret this, it's important to know that.
Ted, hi, it's Juliana.
Okay.
Could I ask a question?
Oh, hey.
Hi, how are you?
Good, how you doing?
Good, thanks for the shout out. So I actually have a question about column 3, the reduced access to markets. Should we interpret this as the consequence of quarantine measures or lockdown measures, or should we think of this as supply chain disruptions?
Yeah, so the way it was asked in these surveys would combine both. and the question was pretty general, so wouldn't allow people to distinguish it. But it had to do with difficulty accessing markets or goods. So it could be due to lockdown where you can't leave your home. It could be due to, say, disruption in public transportation where it's harder to access markets, or it could be that the market is there but goods aren't flowing in. So it was asked in a very general way. Yeah, so that's my understanding there, where it's not able to distinguish between those. And my understanding, Juliana, you'll know much better than I, but my understanding is for periods of this of the pandemic, Colombia had a relatively serious home quarantine or lockdown. So maybe that's part of why the rates are so high there. But you're the expert on their policy.
No, I agree. That's why it was just a curiosity because it's so low in other contexts. So it's just Colombia kind of stood out. So that was my question. Okay, thanks.
Yeah, exactly. And I think if you look at that rural sample in Bangladesh, when the government wasn't doing any real lockdown in rural areas, you see like everybody's like, yeah, I can still go to the market. Whereas in Colombia, where people were like, you can't go more than a kilometer from your house or whatever, clearly it was like very, very restricted.
Right, thanks.
Yeah, thanks. Okay, the next, I already talked a bit about the Kenyan sample. Let me just jump down to one more sample here. The Philippines, just to get another Asian sample. And then I'll go to the bottom row, which shows the median. And then I'll show you some other data. But if you look at the Philippines is also a middle income country, richer on average than most of the African populations. But again, you see very high rates of drops in income, employment, increased missing meals. Again, lots of disruption of markets there. Even in a setting where, and I'm emphasizing the Philippines here because even in a setting where receiving NGO or government support was very high in the Philippines. 40% of the sample said, yes, I did get some additional government support, but it obviously wasn't enough here. The Philippines is also an interesting case in terms of access to markets. So many people in the Philippines are living on many different islands. So you could imagine that lockdowns of various sorts, if they disrupt shipping between islands, movement between islands could be really disruptive in terms of access to markets and goods. So for Philippines, it's 77% of people say, yeah, I was negatively affected here in terms of access to markets. Okay, let me just jump down to the bottom row. The median share across these 16 populations, just to give you a sense of like the central tendency in the data, was about 2/3 drop, of respondents having a drop in income, about 1/3 a drop in employment, and then pretty large shares with reduced access to markets, healthcare, and the median share with an increase in food insecurity, this missing meals, was about 0.45. So again, our best take here, if we look at food insecurity as a pretty nice summary measure of living standards decline, is very large shares of the population are experiencing these effects. All right. So that was the whirlwind across all this kind of global sample, telling a pretty dire story. Let me show you a few more patterns from different samples, and then we'll get into some sort of general discussion. Here I'm going to show you data from Kenya and Sierra Leone, and the reason I'm showing you these is these were both samples that collected high frequency data. So in Kenya, we were doing surveys every week on representative slices of the population. And then when we went through the whole population, we surveyed the same people again. And we ended up doing multiple rounds of surveys for everybody over the period. And Sierra Leone did something similar, one of the SLE1 sample. So I already showed you in the top left the profits and revenues. This is just different colors of the figure I showed you way at the beginning, showing you the drop in profits and revenues in our rural Kenyan sample. Then we have a rural Sierra Leone sample. And they also had recall data back to the pre-period, and then pretty good data into April through June. And what you can see in the Sierra Leone sample is a pretty similar drop in profits of about 58% and sustained over this period. So again, in terms of the depth of the recession, not only did most people experience some drop in profits, where we can measure the sort of time pattern and the depth, it looks pretty bad in both an East African setting and a West African setting, say 40 to 50 or 60% drop in profits. For Kenya and Sierra Leone, we also have some other parallel measures, household expenditures, and then we also got price data. So let me show you the Kenyan data. Before, I just showed you overall consumption expenditures across all categories. Remember, the average drop was like 23%. What I'm showing you in panel B1 is the drop for both food expenditure versus non-food expenditure. And you can see both of them fall significantly during the period, food expenditure by 7%, non-food by 40%. This gets back a little bit to kind of the question above about, what choices are they making? Clearly, it looks here like they're trying their best to preserve food expenditure at the expense of non-food, totally reasonably. You got to eat first before you do anything else. So food expenditure is still falling, but less than the drop in non-food expenditure. Okay, so that's one other pattern here. For Sierra Leone, though, total food expenditure is pretty flat. If anything, it goes up slightly. You might say, well, what exactly is going on in Sierra Leone? Why is food expenditure going up? If you look at panel C2, you see why. Food prices in Sierra Leone, in rural Sierra Leone markets where the team was collecting data, actually went up considerably. So food prices, and this is an attempt to get a price index across major categories, went up 16%. Total spending only went up 8%. So in terms of quantities purchased, it went down somewhat. You can kind of see that. Whereas in the Kenyan case, food prices were really flat. So that was very fortunate. Some other non-food prices, if anything, in Kenya fell slightly. Okay, so actually the evolution of prices is quite different in these different settings, reflecting the market environment or where they are in the harvest cycle, et cetera. Natalie, do you have a question?
Yeah, well, I think you already saw the answer, but I was just wanted you to speculate a bit more about why prices went up so much in Sierra Leone but didn't in Kenya, because this seems like a very interesting difference. And I know you have only 2 data points in a sense, so I know that's a hard thing to speculate about.
Yeah, totally. I will say I used to work in Sierra Leone. This Sierra Leone data was collected by a different team, but for 4 or 5 years, about 10, 15 years ago, I worked in Sierra Leone. And I would say, at least anecdotally, or like my own experience, is the transportation infrastructure is way better in Kenya than Sierra Leone. Like the road infrastructure in Sierra Leone is terrible. Even major highways are just of way lower quality than what you see in Kenya, for a variety of reasons. One is Kenya is just much richer than Sierra Leone. Kenya also has, a big tourism sector, which sort of relies on decent transport, et cetera. So, it could be that there were more local price spikes because of a lack of market integration in Sierra Leone. That's my speculation, because, again, it was another team that was part of this whole consortium that gathered this data. But it's not as shocking to me that food prices in Kenya would be more stable. The government in Kenya also has a system of grain storage facilities, which they can release grain onto the market. And the region we work at also in Western Kenya is right on the border with Uganda. There's very active trade, both legal and smuggling of grain across the border. So it just feels like there's going to be more scope for market integration in Kenya than Sierra Leone. That would be my sense.
Thanks, that's fascinating.
So just to make sure it's not some agricultural cycle related.
Yeah, so this period in Sierra Leone is not the hungry season. Actually, the rains are starting during this time point, but it's not the hungry season. Whereas I said in Kenya, if anything, we are getting into a kind of hungry season, but these drops are sort of more severe than we would expect. But no, this isn't the hungry season there. And then I'll mention, just Victor, because you raised it, I'll mention the seasonality and the hungry season for Bangladesh and Nepal in a couple slides, because that was one where we have some more data. Okay, so this is Kenya and Sierra Leone. Let me jump into food insecurity again in these 2 samples where we have this kind of high frequency data. I already showed you the Kenyan data, and actually I realized here for the food insecurity we have a slightly different time point only through late May. That's my bad. I should have updated that panel. But you already saw the food insecurity for Kenya through late June. For Sierra Leone through late June, you see this kind of similar pattern of an increase in food insecurity, both for adults and children. In this case, the proportional increase is larger among adults from a higher base. So if anything here, it looks like kids are being maybe more insulated than adults. But again, the food insecurity situation is quite troubling in Sierra Leone. And again, from much lower income levels than you would observe in Kenya. Another dimension where we collected data in Kenya is on domestic violence. And there were different measures in the survey. There was a measure of violence against children where the respondent was simply asked whether children had been beaten in the last week. And the rates to begin with are quite high. They're between 15 to 20% saying yes. And they increase on average during this period by 13%. So that's, again, 13% on the base of 15 to 20%. So it's an increase of a few percentage points on an already high base. Then in cases where there was a female enumerator asking a question to a female respondent with sufficient privacy, there were a series of questions about adult domestic violence, where there were actually 4 different dimensions of domestic violence that an adult female could have experienced, and this here is an average across those categories, from beating to forced sex, etc. And the base level there was, I think, 10 to 12% on average across these categories, experiencing some form of domestic violence in the last week. And that increases slightly by about 4%, but it certainly doesn't fall. So if anything here, when we get into these issues of violence in the household, these effects are not statistically significant, but if anything, they're increasing somewhat during the pandemic for women and children. All right. So I've again done a, yeah, please go ahead.
Clarification just about the interviews with women. Is it how they were selected? How were they selected for an interview? Just what
it really depended.
Are you talking about women households or just some other?
Yeah, it was really the way it worked with these surveys in Kenya is whoever picked up the phone number we had. So
okay.
we had done the household census, we had a phone number, we called it, and we have a team that's roughly 50-50 male, female enumerators. And if there was a female enumerator making a call and it was a female respondent who happened to pick up, and when asked by the when the enumerator asked the respondent, can you talk about this, etc., then those questions were asked. So that was the way it worked. So of course, we only have this for a subset of the population for the adult domestic violence. For the children's domestic violence, it was asked of all respondents, males and females. And, respondents were very open to answering it because there's really not, in my own experience working in this part of Western Kenya, there's really not that much stigma at all against saying that children are beaten if they're bad or if they do something wrong. It's kind of like a normal thing, unfortunately, in my view, but that's how it is. Okay. Okay, so let me move on. Yeah, let's.
Yeah, sorry. One question on violence. So, do you relate the possible increase in violence to like the lockdown situation or to the economic crisis, or both?
Yeah, it's hard for us to say, why it is. Yeah, I can't really distinguish it. One thing that I'm not presenting here is I mentioned that we have data even into July and August. And that is a period where we are seeing some recovery in terms of loosening lockdown, some economic recovery. But to be honest, I don't remember what the domestic violence numbers look like in August. It is on that Kenya COVID tracker. So actually we could click through on that and look at it now. It should be plotted out. So I'm not sure if it kind of goes back to base levels or what happens, but that could maybe shed some light on how the loosening of the lockdown could affect these things. Yeah.
Or perhaps if you have like geographical variation where you have one part of the country that experienced like a stronger lockdown and not the other, that could be.
Yeah, I think the issue here with this particular Kenyan sample where we have such detailed data is it's all this one county. Okay. So unfortunately, we wouldn't have sufficient variation. We do have a national sample, but it doesn't have, we have a Kenyan national sample, but it doesn't have as detailed questions as this particular sample. Let me think though, actually, let me take a note on that to see if in the national sample, we have enough variation to look at those differences. Thank you.
Can I just also, can you confirm, you said that that variation was not statistically significant?
That's right. It's not a
Okay, so
significant increase.
Maybe that's, I hate to assume that it makes it unimportant, but that's, I think it's.
Yeah, maybe we should emphasize it less. Yeah, I mean, if it's by chance, then we should emphasize it less. I do think that, yeah, that's right. I mean, some of these other increases are very large. Even the top panels here, very significant. The domestic violence numbers are positive, suggesting more domestic violence, but not as maybe statistically convincing. Yeah, I think that's fair. Okay, let me
just have a
please go ahead.
Go ahead there.
Please.
Yeah, so you're describing the measure of children as domestic violence, but would it be more appropriate to label it as corporal punishment? Is it violence?
Yeah.
In terms of like leaving a mark is typically how it's differentiated for adults.
Yeah, let me take notes on that. We've been sort of grouping these together and sort of taking a beating, the child being beaten as domestic violence, but that's a matter of perspective. Certainly in my understanding of the Kenyan context is people would not see beating a child that did something wrong as domestic violence. They would see it as sort of a normal form of corporal punishment. So, maybe using the term domestic violence brings a normative perspective into it. But yes, I think most of the respondents in this setting would view it as just normal corporal punishment. That's right.
Yeah, absolutely. Same for the Malawian context, which is what's on my mind. So yeah, I think it may be more appropriate to focus on the measures of violence among adults as, distinct measures. Typically those questions are asked in a distinct way than, was the child potentially beaten? Yeah,
right. Yeah, I think that's right. It's again, a matter of perspective and, but certainly in the Kenyan context, you're right that's how it would be framed. So thank you for that comment. I've taken a note on that. Thanks. All right, great. So let me go on to some of the issues. We've already discussed seasonality, and I mentioned how in the East African case, there is some seasonality that's relevant during this period, but it's smaller. In Bangladesh and Nepal, the data that's being used is part of a longer-term longitudinal data collection effort. So they can actually track what these variables look like in 2 earlier years, month by month. And we can compare 2020 to those earlier years. So this is a way to kind of directly get at seasonality. So this is a nice feature of the data from Bangladesh and Nepal. So I have this figure here for those who are interested. The left panel is percent of households that are food insecure. And the right panel is the food insecurity index, which is a combination of a few measures. And what you can see here in the black line with the gray is data from a couple of previous years in terms of average rates. Maybe the left-hand panel is easiest to interpret. Percentage of households that answer that they are food insecure, they are missing meals, et cetera. You can see in Bangladesh, the lean season is earlier than it is in East Africa. It's sort of in October, November. Then after the harvest, there's a big drop in food insecurity. And then maybe, it starts rising a little bit in the middle of the year. If you look at 2020 in the early part of 2020 pre-COVID, in those blue plots, it looks like dead on like the average of these 2 earlier years. Once we hit the COVID period, there's this really big increase in food insecurity in the April and May data. So I think this is pretty good evidence that this year looks quite different than previous years, even accounting for some seasonality. And it's very much the same story for the Nepal data, which uses a distinct index. If you look at late 2019, it tracks the earlier data, but then in 2020, there's this big increase in food insecurity. So I think in those Asian cases, it really looks like this isn't just a seasonality story, but there really is a rise in food insecurity. Another thing that I've gotten to a little bit that's very important is, how representative are these populations? I know we have the 16 samples in 9 countries, so that may feel kind of representative, but the truth is each of these samples has their own characteristics. Even the samples that purport to be national samples may not be fully representative. Some, as I mentioned, the so-called recover surveys are based on random digit dialing. And when we compare those populations' education and income to national census data or nationally representative, statistical agency data, the folks who are being surveyed through random digit dialing are more educated and have higher income. The RCT study populations vary. Some are richer, some are poor, but many of them are actually poorer than the national population. Like RCI, a county sample, it's an agrarian sample. We worked there precisely, or the NGO giving cash transfers worked there precisely because it was a poor area. So there is no like simple characterization of representativeness, but it is kind of noteworthy that across all these countries and some kind of richer populations, poor populations, above and below median SES, as I showed you in the table, we're seeing these big drops in income and these increases in food insecurity almost across the board. So for us, that was a indication that this recession was pretty meaningful in many different subpopulations in low and middle income countries. So that's our take on it, at least as a kind of general characterization of what's going on. Okay, let me get into my kind of conclusion. I just have a couple points to make, and then I'll be delighted to move into broader Q&A. What's the appropriate public policy response here? As I mentioned, most of the surveys we've done indicate that the majority of people are not getting much assistance. In some countries it's higher than others, and over time programs have been rolled out, but clearly the food insecurity data we're showing indicates that whatever programs are there are not sufficient. I mean, maybe there is some assistance, but if 50% more people are missing meals, the assistance isn't going all the way. So this does point towards the need for large-scale government programs, international assistance to deal with food insecurity. A rise in food insecurity among children, like the kind that we've documented, could have very adverse long-run effects. Kids who are undernourished in their youth, that could affect their growth, that could affect their health later in life, that could affect their schooling outcomes. So this does seem to be an important need. At the same time, we're in a situation where the kind of obvious donor countries are, like the United States, are ourselves facing a huge recession, and in the case of our country here, a kind of political and social crisis. So, how much will is there in the United States or in the UK or in France to launch a major new international assistance initiative to help poor children in Kenya? I would say right now the political will is not really there in this country, but the need is clearly there. In terms of more recent data, again, I was really focusing through March, April, May, and June, but the more recent data that we have, which you can check out on the tracker, indicates there has been some recovery in recent months. Lockdown restrictions have been eased, businesses have been opening, restaurants have opened, and there is some economic recovery. In fact, we've been collecting some survey data, even on basic measures of social distancing and mask wearing in Kenya over the last month, and it's very minimal. We've been having enumerators go to markets and just record the proportion of people wearing a mask in Kenyan markets in Western Kenya. And the rates are between 5 to 10%. So effectively, there's not much sort of pandemic response going on, at least in our areas of Western Kenya. At the same time, there may need to be some change in policy. So again, I mentioned that just yesterday, I looked at the Daily Nation in Nairobi, and for the first time, they're talking about ICU beds starting to get crowded in the big hospitals in Nairobi. Schools opened a few weeks ago. So that was a bit late. Several of Kenya's neighbors had already earlier opened schools, like Tanzania. But Kenya finally reopened schools. Just in the last week, there have been multiple outbreaks of COVID in schools, and one principal is seriously ill from COVID, et cetera. How much longer will the schools stay open? So, again, even African countries and other low-income countries that have relatively few cases may see surges. We can't rule that out. It's a very uncertain policy environment. And even if there isn't a surge, even if some sectors are able to remain open, like in agriculture, et cetera, for a country like Kenya that relies so much on tourism, that's a transport hub for the wider region, certain sectors are going to remain depressed for a long time. The tourism sector isn't going to come back until there's a vaccine that rich Europeans and North Americans and Japanese and Chinese tourists feel comfortable traveling globally again, internationally again. So So I think the environment remains really uncertain, and there may be this kind of whiplash of opening and closing, even in poor countries going forward. What we can see in the data is the initial recession was really quite severe. And if you take anything away from this talk, I think that would be the punchline. So let me just leave it there to save time for questions and comments.
Thanks so much, Ted. This is really interesting talk. So we have about 8 minutes for other questions for Ted. So I think the easiest thing is if you have a question, you can post leave a question in the chat and I'll just call on people. And I think, Victor, you've posted a couple things in the chat over the course of the talk. So maybe you want to ask a question and I'll keep monitoring for other people.
Yeah, again, I already talked quite a bit. Maybe someone else can turn, and then now if I have time, I'll ask again. So is anyone else who hasn't spoken yet? Or I can go ahead if you.
Yeah, nobody else has posted just yet in the chat, so I think you can, while you're asking, hopefully some other people post.
I think again, this maybe something that you may not be able to answer in a few minutes. My question, a kind of methodological question, but first of all, about the you have a very impressive response rate for a Kenya survey, but still, I'm worried about response bias and what you think about it. What can you do anything to adjust for it? In a related question also about data quality, I just read what I just posted. Should we worry about possible...
Should I look at the chat? I can bring up, is it on the chat or I can try?
Yeah, both of them are on the chat.
Okay.
But they'll
kind of... I mean, why don't you go ahead and ask it?
I think it's easier.
Let me just, again, in the interest of fairness and inclusion, this is my first question. This is about response bias as opposed to response rate. And what do you think about it? You're missing like about 20% of the households.
We're thinking here about like experimenter demand effects or desirability bias, those kinds of things.
Oh, those are actually part of my second question. Yeah, but I'm thinking, whom are you missing? That's 20% of probably the least, most vulnerable, perhaps more.
Yeah, I think that's totally right. That's how we're thinking of it. I mean, first of all, the people without phones we're missing. And the people who still don't have phones in Kenya are the poorest, for sure. We're missing them. Maybe their effects are even more severe among that population. We don't know. Yeah, or maybe they rely on subsistence agriculture, so they don't care. But so I think we can't fully characterize it, but I think it's safe to say those are the poorest who are not responding. Yeah. In terms of desirability, this is something I think that's quite important. When we ask certain questions, all these questions are meant to be quite specific. We're asking about specific earnings in the last week or specific, data around firm outcomes, even the meals variables, how many meals, et cetera. So we're not simply asking, we're certainly not asking, do you need help? Because we're not providing help. This is a research study, we tell them that, but we're trying to be very specific and quantitative. And the hope is that would somehow deal a bit with desirability bias effects. I don't think we can entirely rule out that people are exaggerating their, how bad their circumstances are, hoping there'll be some assistance. I don't think we can rule that out. I will say that in our case in Kenya, one of our surveys, the one I've emphasized, is sort of like a data collection firm is doing it. Our other national sample in Kenya is being carried out in collaboration with the Kenyan Bureau of Statistics. And I think people know when they are contacted by the Kenyan Bureau of Statistics, this is just a data exercise. They're not going to be getting assistance based on it, and we're getting similar kind of answers, but I can't rule it out. I guess it's the usual thing with our response surveys. We can't rule it out, but yeah.
Yeah, I agree. It's just something that we'll all have to deal with and think about. So
we can't rule
I appreciate it.
Yeah. So I think a while ago, Ondine posted a question about testing frequency in the chat. Ondine, do you want to unmute yourself and elaborate on your question?
Oh, sorry. Yes, that was at the beginning. Actually, I was just raising thoughts about the prevalence rates, the serology positivity rates, or any other testing. I mean, detection of cases, because the test frequency is just so much lower that was just more or less a question. I don't know if there was any further information available around frequency of tests, but I mean, that's a major issue.
The testing numbers have increased, but they remain lower per capita than we would like. The one study I saw about a month ago, I forget the author though, I could dig it up, is there was an antibody test in Nairobi, which showed a 10% positivity rate. So that was the one study that I saw, and maybe you guys have seen other data on this. There have been similar studies coming out of cities in South Asia, some Indian studies with like even higher antibody rates than that.
Right.
Maybe you guys have seen those. I'm forgetting who the authors were on the Kenya study. I apologize for that, but it was about 10% in Nairobi. So non-trivial. I mean, meaning the virus is there and a fair share of people have been infected.
So, and also supporting the impression that the cases are underreported, basically.
Certainly.
Yeah.
Certainly,
Thank you. Thank you.
Yeah.
Although I would just add there have been no comparable studies of unattributed mortality to sort of back up, well, if antibody prevalence is 10%, perhaps that means there have been fatalities. Presumably they would be in proportion to the risk factors that are present in the population, as well as we understand any of this. But this has been, so many of the surveillance systems are not operating.
That's totally right. And you know, that's right. We've seen these excess mortality data, say for the US or, you know, European countries. I've been trying to keep an eye on the medical journals for similar data in East Africa, and I haven't seen it. Maybe I've missed it, but it sounds like, you know, you have a sense that they haven't been, you know, out there, or maybe they're being assembled now. And that would give us, you know, maybe a better sense. Of course, it's a bit tricky in this case. You know, if we're really in a period in East Africa where there's a lot of, you know, additional undernutrition or food insecurity, breakdown of the healthcare system unrelated to COVID, we couldn't necessarily attribute all the excess mortality to extra COVID deaths, but it would be a start to look at that excess mortality for sure.
Okay, so I think we have time for just probably one more question, which comes from Asel. Asel, sorry if I'm mispronouncing your name. Do you want to unmute yourself and ask your question?
Hi, I'm just curious about, do you have some information about domestic violence in other countries? Because we have a PP project now, and it's our topic, but not specifically Kenya, but other countries like Bangladesh or Nepal. Thank you.
Yeah, so in these 16 surveys, there wasn't comparable data to what we had in Kenya, and that's why I just showed it for Kenya. I know that there's other research teams very actively working in this area, and there's certainly been even some popular media attention around this very important issue. But in our samples that I'm familiar with, that we've been working with, the Kenyan data was the only kind of more comprehensive data on this. So yeah, sorry, I can't point you to anything more on that.
Thank you.
Thank you.
Thank you so much, Ted. So in the interest of letting the pro seminar start on time, I'm going to have to cut off the Q&A period. But Ted, if you could stay online, the pro seminar, I think is going to just start at this link. And the grad students know who they are, and they should stay online also. And thank you, everybody else, and see you next week.
Thanks for the great comments, everyone. It was great. I really appreciate it.
Bye.
Bye-bye.
Hey.